Assalamualaikum. My name is Mustahsan Aslam. I am student of 3A group second year. Today my presentation topic is about insulin. Insulin is produced by the endocrine part of pancreas. Other than insulin, pancreas also produces many other hormones which includes glucagon, somatostatin and pancreatic polypeptide. Glucagon is produced by the alpha cells in the pancreas that increase the blood sugar level, so we use it in hypoglycemic conditions. And then insulin and amylin is produced by the beta cells that decrease the blood sugar level, and we use it in the diabetes mellitus treatment. And then there is somatostatin, that is also called the universal inhibitor of secretions, which is produced by the delta cells. And then there is pancreatic polypeptides, which facilitates the digestion and is produced by the F cells. Now we move towards the physiology of the insulin. Insulin is produced in the inactive form, that is pro-insulin, which also have some glycemic effect, but it is cleavage into two chains of 51 amino acid of insulin and one chain of 31 amino acid of residual C peptide. Insulins have different effects on different organs of the body, as we discussed some important of them, like in liver it helps in storage of glucose as glycogen and also help in the insertion of additional GLUT2 glucose transport molecule in cell plasma membrane, increase synthesis of the enzymes like pyruvate kinase, phosphofructokinase and glucokinase, and suppression of several other enzymes. Insulin also decreases protein catabolism and increase triglyceride synthesis and VLD formation. Now we move another important organ, which is skeletal muscle. In skeletal muscle, insulin stimulates glycogen synthesis and protein synthesis. Glucose transport into the muscle cell is facilitated by the insertion of GLUT4 transporters into cell plasma membrane. Now there is also, it has important function in the adipose tissue. In adipose tissue, insulin facilitates triglyceride storage by activating plasma lipoprotein lipase, increasing glucose transport into cells also via GLUT4 transporters and reducing intracellular lipolysis. Now we move towards the pharmaceutical in preparation of insulin. As we know, in the early ages, human insulin is manufactured by the bacterial recombinant DNA technology, and now the available form provides for rare of onset and durations of effect that range from rapid acting to long acting. There is from it is totally depends upon the lente, which is the combination of zinc and the insulin. Zinc helps the insulin hexameric structure to maintain, so it is depends upon the lente. So it is divided into rapid acting, short acting, intermediate acting and long acting. In rapid acting we have lispro, aspart and glucine. These act very fastly and rapidly and has short acting effect. Then there is a short acting insulin, which are regular insulins we used in daily life. Regular insulins is also insulin of choice in diabetic ketoacidosis. It also there is some intermediate insulins, which are neutral protamine hedgehog insulins. NPH insulin is often combined with the regular and rapid acting insulin. Then there is long acting insulins, which includes glargine, detamar and insulin degludec. These are very long acting insulins. It has effects more than 20 hours, so and cannot attain its peaks. So it has less risk of hypoglycemic conditions. So there is also some routes of administrations. Most commonly we give insulin through subcutaneously, and it is given around the around in the abdomen, and then in the anterior part of leg, lateral part of the leg, and also in the arm. We also give the insulin in the form of intravenously. So mostly regular insulin is the only insulin which is given in the form of intravenously, and then there is also inhalational routes through which we give mostly short acting insulins, and also for postprandial conditions. Now we move on the drugs which acts by increasing insulins. It includes sulfonylureas and maglinides. Sorry, not maglinides, it is maglitinides. And it sulfonylureas contains glipizide, glicazide, and glibenclamide. No, glibenclamide. So sulfonylureas also have two generation. First generations include tolbutamide and chloropropamide, and then second generation which includes glipizide and glimprimide and glibenclamide. Sulfonylureas, the most important is a chloropropamide, which is used in. It is also used in the drug diabetes insipidus, and it also causes some adverse some side effects like weight gain and disulfiram like reactions. So it is also have some toxicities. On the other hand, maglitinides are short acting and we used in only in the postprandial conditions. Now we move towards the side effects of the insulin. As we know, if there is overdose of insulin, that causes hypoglycemic conditions and also results in the hypokalemia and lipoatrophy. And these drugs and insulin is contraindicated with beta 2 blockers. And then we move towards the adverse effect of the insulin: redness of the face and weight gain, sweating, itching, and include constipation. So it is my explanation about the insulin. Thank you.
Hello, Assalamu alaikum. My name is Hussein Ali. I'm from secondary 3A group. Today is my presentation about pharmacology, and my topic is atropine. Atropine, naturally, they are semi-synthetic and synthetic. Semi-synthetic is hematotropine, and synthetic is oxybutynin. The origin of atropha belladonna, an ester of trophic acid and tropine. Mode of action is a block muscarinic effect of acetylcholine. Do not distinguish between M1, M2, and M3. Now it is the brand name and pharmacological name which available in market. In market, they are available in the form of injection form, tablet form, ointment, and solution. The route of administration is mouth, intravenous, intramuscular, and rectal. Respiratory system atropine causes relaxation of upper respiratory tract muscles and inhibition of secretory function of bronchi. In gastrointestinal tract, atropine inhibits motor activity of GIT and secretory function. In urogenital tract, atropine relaxes smooth muscle of urinary bladder and prolong the period urination and can provoke development of urine retention. In eye, atropine by blocking the circular muscle of pupil caused by mydriasis, dilation of pupil. Antidote for cholinesterase poisoning. Atropine block the cholinomimetic effect of these pesticides. An induction is symptomatic bradycardia, intesticide poisoning, bronchospasm, acute iritis, psychophalangeal refraction. Contraindication is hypersensitivity, glaucoma, pyloric stenosis, fever, urinary tract obstruction. Precaution is take this drug with food, avoid alcohol, keep the drug out of reach of the children. Take some rest when taking this drug as it may cause blurry vision. Now, in side effect, are adverse effect of this drug: incidence, headache, restlessness, confusion, insomnia, dizziness, and its side effect is cardiovascular system about tachycardia after high dose, bradycardia following low dose atropine. And now EENT, its adverse effect is photophobia, increase intraocular pressure, blurred vision. Now in GI, dry mouth, thirst, vomiting, and in GU, urine retention and impotence. In hematologic is leukocytosis, skin dryness, other have severe allergic reaction. This drug nursing have some responsibilities. Start with its dose, monitor vital sign of patient every 2 hourly, watch closely for urine retention in elderly men with BPH. Assesses the patient of adverse effect after administration. Report side effect immediately to the consultant if any. Give the drug with food. Monitor temperature in infant and children for atropine fever. And now patient education related to drug. Avoid alcohol consumption. Take this drug with food. Report serious adverse reaction promptly. Avoid hazardous activity until blurry vision subsides. Photophobia by wearing dark glasses. If you think there has been an overdose, call your poison control center to get medical care right away. Avoid OTC drug. Take your medicine on time and as advised by the doctor. And in last, thank you so much for your attention. And in last, please subscribe our channel and press the bell icon. Thank you, sir.
Assalamu alaikum. My name is Mohsen Star. I am from 3A, second year. Today my presentation on pharmacology. The topic is amphetamine. Amphetamine has formula C9H13N. If we talk about the discovery of amphetamine, it was discovered in 1887 and exists as two enantiomers. First enantiomer is levoamphetamine and the second one is dextroamphetamine. Now if we talk about the effect of the amphetamine, it has directly and indirectly effects. So it has both mixed effects. It acts by the displacement of noradrenaline, causes tachyphylaxis, means it produces rapid development of tolerance. It can cross blood brain barrier, so it has effects on the CNS. If we talk about the route of administration, medically it has two routes, oral and intravenous, but recreationally oral, insufflation, rectal, intravenous and intramuscular. Solubility, if we talk about the solubility and the bioavailability, it is water soluble compound. And bioavailability, if the talk about the peak of amphetamine occurs 1 to 3 hours after oral administration and approximately 15 minutes after injection, and it presents a bioavailability of over 75%, means it has a oral route and it metabolizes in the liver, and here it has 75% of the bioavailability. If we talk about the mechanism of action, as we already discussed, that it crosses the blood brain barrier, so it has central nervous system stimulant effect by increasing the amounts of dopamine, norepinephrine and somehow serotonin in the synaptic cleft. Its physiological function is that it increases these amounts. And if we talk about the central nervous system effect, it is used in the treatment of attention deficit hyperactivity disorder, narcolepsy, obesity, and in Parkinson disease. It reduces the sleep and increase the attention span. If we talk about the side effects, it reduces sleep and increase attention span, but it is also helpful for the students and the job officers which want to increase their span and reduces their sleep for duty time. If Adderall and Midacis are trade names for a combination of drug called mixed amphetamine salts. If we talk about the salts of amphetamine, some mixed salts and like dextroamphetamine and lisdexamphetamine are the prescriptions of medications in the ADHD disease. ADHD is the attention deficit hyperactive disorder which is occur in children. So we give dextroamphetamine to these children. Now at the end we will talk about the side effects, adverse effects and the contraindications of the amphetamine. Amphetamine may cause uh, unusual thoughts of behavior, especially if you have a history of depression. It causes mental illness, bipolar disorders, or maybe problems of the blood circulation. If we talk about the adverse effect that are unknown, uh, amphetamines are synthetic stimulants, so which means it speed up the working of brain. There are It speed up the working of brain. There are legal and illegal amphetamines which are long terms. Amphetamine can lead to the serious problems including brain and cardiovascular. If we talk about the contraindications, means in which diseases we can't use the amphetamine with the hypersensitivity to any component of the drug formulation, means the patients which are hypersensitive, they can't use these drugs. And also in the pregnancy, because it can affect your baby's brain and nervous system before birth. Amphetamine cause heart rate and your baby's heart rate to increase.